I think this may be our final seminar of the semester for the Hugill Department of Global Health. This is our Brown Bag series, and I'm really excited to host this session today because this is also the culmination of a semester of work. So our speaker today is Michelle Hugill. She's visiting us from Brazil. She's been a fellow for the past 6 months. She came in December, right before the holidays, but has been working fastidiously really since her arrival. And I'm not going to steal her thunder to talk about the work that she's done, but it's really important. Michelle, just as background about her, is a PhD student at the university, the Federal University of Santa Catarina. I have to do the translation in my mind really quickly. And she also works within the legal sector, providing intervention with people that have perpetrated intimate partner violence. And so this particular topic is near and dear to her heart and her area of work. And so I want to turn it over to her and welcome her today.
Thank you. Okay, so hello everyone. As Professor Daphne said, I'm a visiting scholar here in Emory, and I'm conducting this research under her mentorship and a professor who was a global reference in gender studies. So I'm very glad and very happy and grateful for her guidance throughout this project. As she said, I'm also a PhD candidate in social psychology at the Federal University of Santa Catarina in Brazil, where I'm under supervisor professor at the Investigative, who is a leading research in gender and masculinity research in Brazil. So I think I'm very lucky to have these people advising me, and I'm very glad about it. And my professional work is the State Courthouse of Justice in Santa Catarina, and focus in domestic violence.
I think the up and down arrow, or side to side.
So, Santa Catarina, everybody asks, where are we about Brazil? And Santa Catarina is just here in Brazil. It's the second state from the south, and I live in the coast, in the capital, Florianópolis. Is where I live, where I work, and I do my research there in Brazil. So I'm not talking much about me, because it's important here is the research. So our overview today is to introduce this ongoing research study of intimate partner homicide in the United States that focus on how legal, social, and judicial systems handle intimate partner homicide cases. So we are here to present the preliminary findings from a systematic review we are conducting for global intimate partner homicide prevention policies and protocols, and in-depth interviews with professionals in these sectors. So why does research matter? Intimate partner homicide in Brazil and South America was called feminicide. It's the one of most brutal forms of domestic violence against women. According to UN, last year, over more than 48,000 women died because of intimate partner violence. And so these women died through the hands of the people they know. It's very different from the social violence or like, I'm gonna say, regular violence you have in the world. The other day, my body decided to visit the hospital. And then I got an Uber to go back home. It was late night, and my husband was very worried about that because he said, "I'm getting an Uber in this state." And then why are you worried? But then of course I keep researching. The research mind is dangerous in gender. So why are you asking that? If it was you, would you be worried about that? No, I wouldn't be worried about that. So the hospital, I live in Ville International, so just go in that straight line. And even so, he was worried about something would happen to me because it wasn't true in my mind. So that's how women die, because of their gender. And that is very important research because of that. It's not just because of the gender, but they die for the hands of people who are supposed to love them. Just in America, in the United States, in 2022, more than 1,000 women were killed by an intimate partner as well. So it means every 5 hours, a woman is being killed in America because of domestic violence. According to UN, 1 in 4 women will experience domestic violence at some point in their lives. And most of these women sometimes don't even realize they are in danger. And since 2010, despite important legal advances in Americas, we have in Mexico, in Brazil, in Argentina, here in the United States, legal protections against domestic violence to prevent women being killed. But even so, the rates of homicide of women because of domestic violence didn't decline significantly. It's more like it's been more or less in the same level since 2010. And then why? What's going on? Why, if you have so many laws, or everyone here at least know exists laws against domestic violence? We see advertisements everywhere, the bus stop everywhere. So why women keep dying? And our hypothesis is gaps in law enforcement, lack of reliable data, and persistent and structural and gender inequalities in society. So you wonder why it happened, and then our research problems is law enforcement remain inconsistent and often ineffective. Why you see we have a lot of studies about why women die, how women die, who are the women, who are the perpetrators, but we don't have so many studies about how the system is applied, how the professionals apply law, enforce law, how they interpret that, how to identify the victims, how they identify people in risk of being killed. And so also, less than that, we also have a limited knowledge about how professionals in these sectors, legal, social, and judicial, interpret and apply these laws in practice. So our questions are, how are cases intimate partner homicide or femicide identified and managed across legal, social, and judicial systems? How do people see that? If I call the police, how do police identify who the victim is? The police know how to identify the domestic violence, the power control system. We don't know. What are the investigative process and protocols in cases of intimate partner homicide around the world? We don't know all of them. And how do relevant social markers, gender, masculinities, dynamics affect such cases? We think, like the professionals who work in the systems, they apply the law strictly. Like I have a law, my pronunciation is horrible from this input. So they do that, I have a law, and then I'm going just to turn off my button and forget all the social norms, my beliefs, and apply law. Or everything when I'm going to work, I'm going to bring all my background I have and apply and then say, oh yeah, this is domestic violence. Oh no, this woman is calling me so many times. Maybe she likes to be in the situation. Or maybe she's making up. Is it happening? So you wonder if the professionals are well trained or not. Are they able to identify that and so enforce law appropriately? That's why we try to investigate here. So our overall goal in this study is to understand the structural and institutional factors that influence the enforcement of intimate partner homicide prevention policies and protocols, law and procedures, to investigate these cases, focusing in how these professionals apply, interpret, and implement these policies, process, and legislation in the USA. And then, like a long-term goal, That's what I really hope happens someday. Maybe you will be alive to see that. But it should contribute to the global reduction of intimate partner homicide by deepening understanding how legal protections are structured and enforced across different social, legal, and judicial systems. Of course, you're going to expect good outcomes, but changing social norms, sometimes they are invisible. We don't really know you're doing that. It's very difficult. So, but you really hope you can help somehow identifying our gaps and also sensibilize the manager or public managers, the people who work with domestic violence, to implement those protocols and training people and enforce law. I can say that because I'm in Brazil, back in Brazil, I work in both sides. I do this research, and also I'm a public manager. So it's very important, this research, because you can have evidence-based data and information to help with these people who can apply the law and can enforce law, to have information to sensibilize the people can make decisions. So it's not just through my head, just because I say some things, but it's because we have the information, we have the research saying how to do it. So we have 3 main specific objectives. So the first one is conduct a systematic review of global legal protections. So our inclusion criteria on this systematic review, we got studies from 2010 to now. You're only working with qualitative studies and in English, but in a global area. So any studies published in qualitative from this framework, and also that is has to be related to intimate partner homicide, and it has to see how those systems I just talked about, legal, social, and judicial, have applied the law. We're not interested to know why the violence is happening, because we have a lot of studies about that. We wanted to see what kind of studies we have looking at the system, how the professionals enforce the law and the protocols. That's our interest. So you wanted to examine institutional and professional practices. Then by that, we do in-depth interviews in America with key stakeholders. So mostly in Georgia. So you got people working domestic violence system here, trying to get all these legal, social systems, especially work with the victim protection and intimate homicides, partner homicides. And also, when you're doing the interview, you call snowball system. So you ask the person if they know someone who could contribute in this research. So that's how you get in these people to interview and to get to know their perception. We also don't want to understand what they're going to tell me about the law, or there's people really have a deep knowledge working with domestic violence cases, so they can identify the risks of this domestic violence escalate to a homicide. So people, we want to know their perception, what they seeing doing doing their jobs here in America. And of course, no research isn't matters if you don't have some good results. And we really wanted to have this to make some difference in the real world. So you intended to develop this evidence-based outcome. So two infographics, one for each method you're using. So one for the systematic review, one for in-depth interviews. So when you're going to show our findings, if you have good practices, the gaps you may identify, and hopefully some recommendations. And this you're going to distribute to people, to these professionals in the interview, for people are interested in the whole. Hopefully it also contribute another studies too. So we intend to publish at least 2 academic papers, one for each method as well. So that's what I'm trying to do here. Now the thing you came from, what do you have now? Yeah. As Professor Dabney said, we started really the research in January. So from January to February, mostly we doing developing this both research, both methods, the systematic review and the in-depth interview. So you design the project, decide of the objectives, search questions, and also you have a help of the librarian here. So she helped us to develop the search queries of the research and how you're going to find what databases you're going to use and the code for us to do this research. So after that, in March, also we recruited workers to help us, researchers to help us the screening part. So one of them is here, Vanek. Thank you very much to come. And then we now in this systematic review, in our team has 6 people: Professor Davide, me, Levanek, and 3 more people: Mariana, Veronica, and Ryan. So we all together are doing the screening now. So we work in the system called Covidence. So it's very nice because it helps us a lot to make the research less manual, and then you go more to the good part of the interview, that is reading the articles and choosing what you need for the interview. And now we are in the moment, the part of reading the title and abstract and selecting that. For the second part is going to be the full text review. There's both parts we are working in pairs. So how it is, 2 people must read the title and abstract. So you vote yes or no or maybe. So if both are yes, you go to the next phase. If we have you don't agree, so Professor Davide and I, we can discuss as well to understand why the person chose the yes or no. So if you don't get to agreement, so Professor Davide and I, you're just going to get the final word. Is this going to next level or not? That is the moment you have to in our research right now. So far, we found the sport databases according to suggestion of the librarian here, Shamita, her name. Thank you, Shamita, you've been very nice to us, if you listen. And so she suggests use PubMed, Web of Science, Scopus, and Ibisco. Scopus and Ibisco is the more broad research, so we won't go only for health research. So we found 5,670 studies for screening. So when you put in Confidence, the Confidence already identified almost 1,500 duplicates. So it's already, we didn't have to read it. And so during our reading, we already identified 21 duplicates. So now we have about 4,000 studies for screening, and you already did 1,000. So this team is working very hard, because we started the second week of March. So in 1 month, we did that already. And then from this 681 we found it relevant, we already have 326 studies for going to the full text review, which is very surprising because we were thinking we're gonna find between 50 and 100. So our research was supposed to be up to May. So you're probably going to extend depending on how fast you can do the full readings text review. So our systematic review is registered in Prospero. So if you want to see the project, feel free to do that, and then you can follow how our research is going and understand all the criteria inclusions, all the problem, all the scope, and everything. Just go there. The in-depth interviews, I'm doing alone with Professor Dabney, under her guidance. And we conducted same instructor interviews. We start in March, so we're going to do in March to April. It's ongoing. So from so far, I interviewed 12 people from Georgia. All the interviews are done by Zoom, and then we chose it because then you can record the interviews. It's going to be easier for the transcription part later because Zoom does that. So I'm in this moment, I'm doing this transcription because Zoom does that, but I have to check if all the interviews are doing that, and also taking that to make the coding to to analyze the data with MaxQDA. I told already how we choose the participants, and then our preliminary participants' perceptions. Just decided to bring to you some things are kind of confirming our hypothesis. So the main thing I've been seeing with all the strong people being interviewed is they say that this inconsistent implementation across jurisdictions. Few people from the legal system, they tell the judge that kind of resistant for training because they think they already know what they're supposed to know. It's the law. So sometimes this lack of training of the people, the law enforcement and the justice system are kind of complicated because they think that the law itself is going to fix the problem, but it's important to understand, all of them are saying it's important to understand the social norms. And there's the power relation dynamics what occurs in those intimate relationships. Because if they don't know it, it's happening, what they're recognizing, what they're working with is they struggle to recognize coercive control, stalking, strangulation. There's a serious risk of being escalated for homicide, especially in case of the strangulation. One of the interviews told me, especially if this person is a woman of color, because strangulation sometimes doesn't leave the marks. So if you skin is lighter, it's easier sometimes to see the marks, and then if the skin is darker, sometimes they don't see it. Also, they talk about if the victim, or especially the women, mostly women, they're telling that, is perceived like not cooperative, like it doesn't have the stereotype of a victim. That women perceive a woman like the one is suffering quiet, she fight back for her life. They sometimes are not seen as a victim. And sometimes, of course, accused, like they call the police and then both go to prison or go to be conducted in prison. And sometimes it's worse because the victim is supposed to go to prison. One of the participants told me this has been changing because of law and because of some training. Because before, law used to say who is the primary aggressor. It means who did it first. For example, if I'm in a fighting with my husband and I slapped him in the face, I'm the primary aggressor. And then he spanked me. Who goes to prison and go to, it's me because I started hitting him. And now law is changing for who is the main aggressor, who causes the aggression. So it's important for them to be trained. Also, the participants who work with training around like local and regional and national, they are saying people go to the training usually at the same people all the time. So people are already sensibilized with this gender dynamics. It's not obligation for their training to people to work with domestic violence, go to this training. So it's like an option. So usually it's the same people always go to these trainings. That's some things they are saying that it's very important. For now, is that I'm gonna say, and then I'd like to say once this participants told me sometimes the law punishes the women for fighting for her life. So that's for me got in my mind because I work for the justice system in Brazil too, and actually I see the victims saying that to us too. They don't trust the system sometimes. They are scared, more scared. That Professor David in the article, sometimes they are more scared of law and the system than scared of their perpetrators. So it's sad to know that. And our expected outcomes is, and just I told you, no, it's to do the systematic review of the literature. So it is qualitative studies. See what the results of our in-depth interviews and to find out the gaps the professionals are identifying also good practices we may identify in those interviews. So to concise and these 2 understanding infographics are going to be distributed for free for everyone. Present our key findings and our recommendations, and 2 academic papers. So, let me just finish here with my guide, because I always make a guide because I speak too much. So is this. So more than the outcomes I talk, we'd expect with this research is to contribute to improving how we implement and enforce these protections, and ultimately help to prevent this death. And before I end, I want to express my heartfelt gratitude for the people who are making this study possible. I already told their names, I'm going to say again: Mariana, Lunava, Ryan, and Veronica, for this incredible teamwork we're doing and supporting me as well. Without you, we couldn't do that. So your dedication, your collaboration, and this hard work is being essential for this journey. And especially thank you for Professor Dabine, because her brilliant guidance, we've been meeting every week since I'm here, and her care, and especially for challenging me to think beyond borders. It's been very special for me being here. I'm leaving today, so like in this goodbye moment. So I'm very glad to be here, and Emory to give me this opportunity to be here. I'm really learning, and I've been doing research for over 10 years. It's been very different, a bit challenging, and I'm going back to Brazil with a lot of things to share with them there. Thank you very much, guys. And that said, I'd like to finish and close this speak with the words of the judge Ruth Ginsburg. She's an inspiration for me. She was a judge of the justice system, and I thought her words represent a lot of this research. It is fight for the things that you care about, but do it in a way that will lead you to others to join you. And this really relates to this research, because this research is not just about violence. It's about justice. It's not a war of sexes. It's fight for a healthier society. One where women are not punished for trusting, loving, believing they are safe. This research is not about fear. It's about choice. It's about freedom. Women have the right to live without fear. Not just fear of public violence, but the private terror of being harmed or killed by someone once said, I love you. So it's about a freedom to live, to love, and to leave the relationship without that choice becoming a death sentence. Thank you very much.
Thank you so much. I think you all can see why Michelle is so special and has done such fantastic work. I think we're gonna take some questions. So let's, I just wanna check the Zoom. I don't even know where to see it right now, the Zoom chat. If folks on Zoom have questions, please.
If you go up to the top of the, right where your screen share is, it might pop up.
Okay. If folks on Zoom have questions, please feel free to type them in the chat. And maybe we'll give folks a minute to do that, and we'll start with folks in the room. So if there are any questions from anyone in the room.
So it seems like with the legal jurisdictions and the protocols in place in those jurisdictions, you want to focus on the victim with regards to the outcomes and the experiences they have. Have you given any thought to the perpetrators and the outcomes with resolution to those cases that are?
Yeah, the people we've been interviewing, they said we have a very struggle about law about gun control.
Mhm.
That's the way women be killed more.
Mhm.
So this thing is very important. We have a lot to enforce gun control because we have this national law is being so it says when the guy is a perpetrator of domestic violence, they should take out his gun, take the gun from him. But that is some kind of a culture in America, the right to have a gun. So it's easy for us to say there's like in Metro Atlanta, because people is more open-minded about that. But we can't forget mostly Georgia is a rural area, so having a gun is part of their lives. And people apply law, live in that society, so it's also their culture. And the guy, we don't have, we asked the interviews, what's the common characteristics of the victim, the perpetrator, and most of them says, we have no profile for that, because the violence is everywhere. There's gender norms inside of the whole society. So even people who apply law and enforce the law, they also have this thoughts. So this is most important for them is how to training these professionals to identify the power dynamics of the perpetrator. Sometimes it's very easy to see. The guy, for example, we have the assessment risks can improve to lethal danger, for example. If the guy lost the job, if the guy has a gun, if the guy thought he would kill her, if he, in the violence dynamics, he's keep strangling her or stalking her, controlling things. So people sometimes are reckless to understand that, and it's complicated. Some people work also with survivors of domestic violence and sometimes with their families, and they said the signs are always there, and then one of the person said they don't know that they knew it. So it means after the homicide happened or the attempted homicide happened, people say, but they lived so well together. And they didn't realize, family usually have pieces, like somebody saw something, somebody was so nice guy, so nice girl, yeah, the violence. So when it happens a lot of times people blame themselves for not seeing it. But our research is not really focused on the why the violence happens, it's why you can't avoid violence and these killings to happen. Why are you failing in the system to protect these people to die from intimate violence? Because it's very easy it's like announce it up. Because if you can recognize the signs, we can maybe this 1,000 women who died in 2022 in America may be alive. So I don't know if you could respond to the question.
Yes, I think you did. I have past experience looking at outcomes for perpetrators of child sex trafficking here in the United States. And some of the most damning evidence from that was that it was consistently low and inconsistent among jurisdictions and how they implemented that. So I was thinking with regards to this research project, I'm curious about how that is with intimate partner homicide here and what their sentencing for perpetrators actually looks like.
Yeah, we have 109 counties, yeah. 59 counties. And then we also something about law, we don't have a protocol in Georgia, land protocol. People try to do it like in county and region, but you don't have a whole one. So if you have 109 counties, we have 189 ways of dealing with domestic homicide, intimate partner homicide. So sometimes it's kind of challenging for that, because if you get some people or some regional authorities are more sensible about the themes, it's easier to try to prevent or make the perpetrators accountable. But sometimes it's not so easy. One of the interviews also said some judges, not just one, more than one actually, they said some judges saying women use the system for revenge, to punish their husband. And then I asked, did they have any number or data or something, process or something, So no, they say they don't. Just this perception. And one of them told me something that I thought was very interesting, because it's very easy for us to say, oh, the judges don't want to deal with that because they don't care. It's not they don't care, they just don't see it. What she said is, we have 100 cases of intimate partner homicide or domestic violence. And all of this is 99 are women telling the truth. And you can't forget you're talking about human beings. So yes, there is women may use the system to do it without being honest. So one of them do that. The exceptions sometimes become more highlighted than all the regular cases. So this is what their minds maybe can be this. So that's why probably we're still doing the research, but probably because most of them are saying the most important thing is that this is having this protocol working together, integrated, and also training people. Because if you say, I told you, the signs are always there. But if you tell other women supposed to be blamed because she didn't see the signs on the family, you can't put this blame on these people. We are who we work with that, and we're supposed to protect them. So we needed to know to recognize when there's, for example, I'm enforcing law or I'm a police officer and the victim call me here there. I don't think she's being serious because she keeps calling me all the time and she stays in the house. It doesn't know the gender dynamics, why she's staying. So that is important.
Definitely. I loved your talk too, by the way. It was great. It was very informative. I'm excited. Hopefully I can keep up with where this research goes since y'all are so early on. Because I think it'll be it's needed and it's really interesting.
Thank you.
Mm-hmm.
I do have a question. You spoke about training. When you are talking about training, is it training the workforce, the law side, or training the women? Because I also understand that some women may not recognize the signs of violence and not know how to leave certain situations early on before it gets to a homicide. So is there at any point in your project where you're trying to maybe beyond the in-depth interviews doing like focus groups and having trainings for women as well as the workforce?
No, our research doesn't focus directly on the victims training, but when you talk about the trainings, it's for people who work in the victim assistance as well.
Okay.
So you can go to prevent homicide. So if it is people well trained and able to recognize, they can help to identify some kind of dynamics, very high risk of a homicide. So they can give the proper information for the women too.
Okay.
Yeah, so in kind of way we're doing that, but you're not focusing on the women training, because campaigns and teach them how to do it is very important. But our goal is in the professionals, for them to identify and recognize properly who are the victim, who are the perpetrator, and how to have the means to prevent domestic violence homicide.
Okay. Thank you.
Maybe we can ask if there, I don't know why there's microphones all over, but for some reason I feel like I have to go stand in front of you. If there are any questions, anyone can feel free to come off of mute if there are any questions on Zoom.
Sure, I have a question. So, Michelle, it's all good to see you again, and thank you for the inspiration of your presentation. So thank you for being here and sharing some of your important work and kind of your motivation to doing this. I was interested in your methodology, and if you could speak to how your methodology translates to other geographies. Like, for example, right now I'm calling in from the country of Colombia, so it's a region of a lot of violence that already is there for different reasons, or maybe even other populations. So how does your methodology translate to other geographies or populations? What would say the same? What would you need to adapt?
Yeah, for now, I don't know if you understood your question, but for now, if we decide to choose the systematic review any country across the world that publishes in English. So, because we have people only English speakers, that's why you chose English. So I don't know how to do that from other countries. I'm going to this I'm gonna say there's comparison with Brazil, Brazilian laws and some American laws, but also using international protocols by UN for how to prevent femicides. And then those documents also are going to help us to be more broad and global to see what we have around the world. And then that's what I'm doing right now, even thinking more like locally in South America, for example. It's more to understand what the kind of studies we have in this area, which protocols we have. And then so far we have like already 1,000 title and screenings. We have lots of tactics from South America. I think you have it from all the world already, From Asia, we have from America, USA. So I think you're gonna have a good Europe. So I think you're gonna have a good view about all the studies we have across the world. That's our idea, to understand what each continent is doing. I don't know if I could respond to your question properly.
Fantastic. Thank you so much, Michelle.
Do we have any other questions on Zoom? We took 2 from the room. We can see if anybody else on Zoom would like to ask a question. Any other questions in the room?
I just have maybe sorry. I just have maybe an easy, quick question, but I'm just curious why you decided to restrict the systematic review to qualitative papers. Is it just that you feel like that's kind of like the only data that's kind of going to give you the information that you're looking for, or?
Yeah, because we are more interested in how the protocols are applied and how they identify, like if you can find any biases on the professionals, or because not really interested in the numbers, because in the numbers you have a lot of quantitative studies. So we are more interested to understand what happened to the professional to make them follow or not that protocol. Because some places they apply the law and protocol strictly, so it's easier. Some people they don't. And I can say from my own country in Brazil, and I see here in America too, we have laws. When I tell them, you think the law is sufficient, good enough, always people say, law is great. We have a law to protect people from intimate partner homicide. But what you don't know, it's why some people apply law and some people don't. So that's why you chose qualitative studies, because you're trying to get it more to understanding, like empirical data, why it's happening around how people see it. They can identify social norms or biases or whatever.
And my question is, why did you only interested in intimate partner homicide, not other people like the child, other family member? Because according to my reading, I saw a lot of like killing the child, other family member.
Yes, when we first started here was just going to research women killing their husbands, because they call feminicide. So then we realized like different continents, they take it different. And if I choose research only for femicide or feminicide in America, probably wouldn't find many studies about. So that's why we chose to make it broader. So intimate partner homicide, just our choice to understand why people are killed because of them. So it's not a choice of what the scope is.
I have another question. Have you thought about, with the articles that you identify in the systematic review, the scenarios and the situations that they're talking about in that qualitative data, tying it back to statutes of that region that they're referencing, and like trying to make sense of, that in their protocol? Yeah, so the legal statutes that exist in the places that you're collecting data from the systematic review, have you thought about contextualizing that systematic review data with those statutes?
Oh, understood. Good question.
Yeah, no.
Yeah, we intended to make more like this infographic to understand, like more like a kind of a map where with these studies, when they do the analysis, they're gonna say, we didn't start the full text review yet, but they're gonna say, we have these laws and have these protocols, and they're going to get this critical analysis about how professionals enforce these protocols and laws. So we intend, we can do it, to do this region map, like maybe from continent or maybe for each country you find. It's very similar to how UN did in their protocol. They did this report. They did it as broad things you can find at the common results you can have in the broader world. But also if you have specifics, you can talk like this country has this law, it is this way, this country that way. So in Europe, maybe if you get enough information, you can talk about continents. So that's what we're probably going to do.
Okay, yeah, that makes sense. Thank you.
I don't have a question, but just like a reflection, and I really enjoyed the talk and it was really informative. We're doing with Dr. Evans as well, like another systematic review on intimate partner homicide ideation and risk assessment tools. So it's really like informative for me as to see how you're doing the research and what things are you are including, as though like this is focusing on the law enforcement, but we're focusing on the perpetrators, and they go hand in hand because what we're trying to find will help aid the law enforcement people to identify and properly assess those perpetrators so that it doesn't go to like lethal homicide. So I've really enjoyed it and I'm really excited to see the results.
Thank you.
It's almost like I planned it. I'm glad you see the do we have any other questions from Zoom? Well, I want to thank everyone for coming. Thanks to those on Zoom, thanks to those in the room, and first and foremost, thanks to Michelle for this excellent work. I know it's gonna end in some wonderful products that will make a difference. So thank you so much.